This meeting is being recorded.
Porque inclusive era de esas primeras veces en las que yo decía, bueno, estoy revisando, estoy haciendo chequeo. Yo recuerdo que el primer día que yo llegué a Rolando Cancer Treatment Center, eso para mí fue cuando yo leí Cancer Treatment Center, yo sentí frío por dentro, porque yo dije, Dios mío, yo tengo cáncer, soy yo.
Well, hello, good afternoon. Good afternoon, everybody. Welcome to Rullan University Habronima lecture. I have you currently on mute, but if you want to talk, you don't have to, you just unmute yourself and talk, okay? So feel free to keep it interactive. Before we start, any questions, any wins that you have from the week, any questions about realizations, anything that you want to bring to the topic before we start? And feel free to unmute yourself. I just want to keep the noise down. Good. Oh, great. That sounds great. Awesome. Yeah.
No, look, we don't have questions right now.
Who's that? On camera. Put yourself on camera.
María Camila.
Let me see your face.
Ah, espera, ¿por qué no? No sé por qué no se prende. Espérate, a ver. Creo que ya.
Talk to me,
Sí,
María.
¿Ya? No sé. Es que no sé.
Okay, got it.
¿Sí?
Hey, Brian has a tie today. Maria Camila, what's your question?
No, I say right now I don't have it, but we will see.
Oh, you don't have a question. Okay, okay, good. All right.
Just to answer.
Okay, love it. Thank you. So, Andrew requested me to talk a little bit about about summer sores last time, and I want to make sure that I honor my commitment and answer that request. All right. So if you have any questions or any comments, I want to start to pose a question. Please post it. That is, we'll keep it relatively informal. So I'm gonna start this presentation of this guy, of this summer sort of thing, with just a case, and then you guys can stop me and interrupt me whenever you want to. This particular case is a 20-year-old thoroughbred. He's retired. It was a gelding used for flat racing. And the main concern by the client is that the horse was developing some masses in the feet. And these masses were developing over time, and the owner was not 100% sure what it was, but he was getting tired of these masses and wanted to pull the trigger and try to solve it. This horse had some emotional value for the owner as well, because he used to belong to his sister, and his sister had passed away, so there was a very tight emotional connection, and he really wanted to solve this problem. Okay, this is what these masses look like. Obviously the horse is facing the camera, and in this picture we see 3 legs. And if you can see, the 3 legs are affected. In reality, all 4 legs were affected, but the camera was just not working right, I guess, and I couldn't find pictures of all these horses' legs. So this is the initial presenting complaint, and this is some more pictures of the legs that were not in the initial in the initial picture, but I'm gonna give you some time for you to appreciate the masses that are going on over here. They are invading in the hoof as well as the skin. They obviously seem that they started in the coronary band. So what are the differential diagnoses for this particular case? We'd say we're talking about habronema, habronemiasis, we also call it summer sores, and we're not 100% sure at this moment when we start looking at this horse that it is habronema. However, we're going to treat it like habronemiasis to begin with. So I'm going to go straight to the point. What is habronema? What is it? It is a disease that is spread by the fly, right? And this is the life cycle of the habronema larva, because bear in mind that I'm gonna summarize it for you very simple. The fly takes the larva of this nematode, and the fly deposits the larva around the mouth. Usually, on the normal stage, that larva is ingested by the horse. The larva goes to the stomach of the horse, or the intestine, but mostly in the stomach, and develops for about 60 days. Then that larva is excreted, and then that cycle continues, and the larva then goes back to the fly, and it goes back into the mouth of the horse, and it becomes a life cycle of the larva. However, some of these larvae are not going to the stomach of the horse, and they end up in the skin. And when they all end up in the skin, they actually cannot complete the life cycle. And what happens? Let me give you another cool illustration here by Arizona Equine. So in the picture of the left, you can see that if the larva is deposited on the skin or the eye or any other tissue, then that larva cannot continue to develop. It gets stuck, it dies, and it creates a reaction. it creates a hypersensitivity reaction that we're going to eventually talk about summer sores, right? In the normal stage, you can see that that infected fly, the larva, is around the mouth, goes to the stomach, is pooped out of the horse, goes into the feces, and then develops, matures. The fly picks it up again, put it in the horse's mouth. The horse eat it, blah blah blah, and it continues that cycle. Now, there's some interesting things that need to happen for this, which is one, there has to be flies. There has to be flies, and for flies to exist, to breed, to spread these larvae, they need a really nice, comfortable environment, right? What's the environment that they like? Well, they like manure, poultry litter, fermenting vegetables, kitchen waste, wet and manure sod. They like strawberry. They love garbage. Poorly composed manure. The phase fly specifically requires fresh horse or cattle manure. They want it fresh to develop. And we can see in this paper that I share you that to replicate, to mate, to reproduce, they need this type of environment. So it's fair to say that these larvae really like it dirty. All right. So it's important that they can be confused. These tumors can be confused with carcinomas. They can be confused with just simple proud flesh, or they can be confused with pythium, pitiosis, which we have talked in other masterminds and journal clubs. We have talked about pitiosis. How do we treat these things? We can treat them one with ivermectin. Why do we treat with ivermectin? Well, to stop the cycle at the stomach of the horse. I show you the life cycle, and that's what we treat with ivermectin. Topical anti-inflammatories to combat the hypersensitivity reaction. We do surgical debulking. We could do cryotherapy, and we could also do local ivermectin. Prognosis, that's usually good. It could be tedious and difficult to treat. Some of us have treated some of these cases that are so tedious and so difficult to treat that require multiple treatments, change of anti-inflammatories, change of strategy, etc. Also, some horses could potentially be predisposed genetically to some summer sores. I personally had a mare that used to get a summer sore in the face every summer. Doesn't matter how much ivermectin she had, doesn't matter how much treatment she got big summer sores. So some of these horses might have a low immune system as well, and that's why some of them have hard time clearing the infection. Obviously, if the fly is a big problem, then how we can prevent it? Well, clean environment. If they like it dirty and wet and nasty, then we keep it clean and dry for them, right? We can do fly control. We can do ivermectin dewormer relatively regularly. We can do really smart waste management. For example, if we have a if we have a manure that is really close to the barn, then that's going to be very difficult if it attracts a lot of flies. It can have, we like in our clinic a lot of fly spray. That's usually very helpful. And be careful, because a lot of farms like to dispose the manure over the pasture, and that can complete and be used to complete the life cycle of the fly and the fly eggs and the larva. So that could actually be detrimental for the life cycle.
I got a question.
Yeah.
So,
Yeah, you there?
can you hear me? Because we're doing dual stuff, so can you hear me over Ryan's audio?
We cannot hear you, but feel free to type the question if you want to.
You unmuted?
or get close.
Unmute Corey.
Using yours.
We'll send feedback. Can you
Okay.
hear me?
Oh my God.
It's too much effort. Never mind, it's too much effort now.
Just here. Can you hear me?
Yeah, I can hear you.
Okay, yeah.
All right, my question on was for disposing of it in the pasture. If you have the muck spread out over a reasonable rate in the Florida sun, would that not cook and kill any parasites within the manure?
Corinne, can you translate in English? I couldn't hear him.
Sorry, if you spread the muck over the pasture, if you spread it really thin, would the Florida sun not kill the parasite within the
Yeah,
manure?
if you dry it. Yeah, if you keep it dry, if you let it dry, definitely. What they like it is wetness, and dirty. But if you keep it dry, they will definitely stop reproducing.
How often should you give ivermectin?
Great question. Really good question. So they have been telling us that to stop giving ivermectin every month, like back in the days they used to do. You could actually do a fecal test and figure out if there's shedding, and then do ivermectin based on that. Now, if you have a horse that has the summer sore, then obviously you don't have to do fecal test, right? Just go ahead and ivermectin. And there are multiple trains of thoughts out there. Some people have suggested up to once a week for 4 weeks, and then some people every 2 weeks. But some of them I have had to do weekly actually until we have completed the resolution of the problem.
Will that make ivermectin less effective for them in the future?
And that's what you read in the paper, right? If you read in the introduction, it says that we could be potentially increasing the resistance to ivermectin, to macrolides. Yeah. Yeah, good question.
Andrew wanted me to ask you about the study that just came out that talked about the effectiveness of that of each individual dewormer.
We're in trouble. We're in big trouble. There is a significant, at least in Florida, there is a significant increase in antiparasitic resistance. So it's important to be extremely careful on the deworming. For example, there are, like Andrew was saying, there's proof that in Florida in the summer, parasites are not surviving in the paddocks. So it would be smart not to deworm in the summer actually. So a lot of farms should start considering not to deworm in the summer, but to actually do fecal test. And by doing that, we are starting then to try to decrease the antiparasitic resistance. Now, bear in mind, I am not a parasitologist, okay? I'm not a parasitologist. I'm just talking to you from the veterinarian's perspective. So what I recommend is, if it's really hot, we're not doing ivermectin, we're not doing antiparasitics, we're actually doing fecal tests, or not even deworming. Plenty of research out there shows that they are not parasites in the paddocks right now.
Thank you.
In the winter, more commonly, we start deworming. A lot of resistance with the previous, like Panacure, Strongit, a lot of resistance on that. Seems like Quest Plus still has some effect, some efficacy. Especially it also, the good thing about Quest Plus is that it also attacks the cyatostomes, which is some of the ones that get embedded in the gut, in the wall, in the lining of the gut. Now, the good news is that if it's Habronema, we can still do ivermectin. All right. So One of the things that we have been doing, which is not in the paper that I just shared with you, is we have been doing hyperbaric oxygen chamber. We know that this is not a widely common treatment because it's not widely commonly available. However, think about what we just talked about in the past. There could be an immune system component, while hyperbaric chamber increases the stem cell mobilization from the bone marrow. So it makes sense that we could use the hyperbaric oxygen chamber to increase the immune system. It also, as you read in the paper, that there's going to be some necrotizing tissue in the area, and we know for sure that the hyperbaric oxygen chamber will increase the healing of necrotizing tissue. And in addition to that, it will actually, the oxygen will help heal the open wound that is there. However, bear in mind, the use of hyperbaric oxygen chamber is going to make absolutely no difference if we don't remove those eggs. Because if you go back, to the initial slide that I was presenting you right here, we can see that the fly that gets into the skin does not complete, the larva that gets into the skin does not complete the life cycle. So if it doesn't complete the life cycle, that larva is going to die. And it's going to be a foreign body. Basically, it's just a foreign body in the skin causing that hypersensitivity reaction. And that's why that granulation tissue goes like crazy on it, because there's basically a foreign body in there. So this is the case that I just presented to you, and you can see in this picture how we started cutting tissue away, and this is a close-up right here, and you can see all these little rice type of looking things. So this is what I'm talking about. These are dead larvae right there that the poor things were never able to complete the life cycle. So they got stuck in there. And they could actually even calcify sometimes. So this is another example. This is another one. And look how it invaded all the tissue up here. All the tissue. From the coronary band, it kept eating away and creating this nasty hypergranulation, hypersensitivity reaction. You can imagine that this has been here for a little bit. This is not a very acute. This particular case is not a very acute problem. This has been here for a while. And this is a more detailed close-up of the area. This is after we cauterize it. We cut it, we cauterize it, because sometimes they could bleed a whole lot. This could be very bloody. Look how we cauterize it. Now this here that we have a tourniquet. Obviously this horse is blocked, so we don't have axial sesame block to desensitize the whole foot. And then we use a very primitive but effective cauterization method. We use a hot iron. Hot iron, that is a very effective, very primitive, but very effective cauterization method. And this is what it looks like after treatment. This is after everything that I told you, debridement, ivermectin, and hyperbaric oxygen chamber treatment. You can see how this horse had significantly.
Hey, Doc,
Yeah.
does that have a particular smell to it?
What?
Like the cauterization?
Oh, it smells very good. It smells like you're in the abattoir. It's like burning hide. So if you ever burn hide, or if you ever been out on a farrier doing a hot chewing of the shoe, that's what it smelled like. So here's another close-up of the injuries. We can see that I just wanted to show you, some people don't believe it's the same horse, so I wanted to show you a similar picture to the initial one I presented, because this horse did very, very good, like most of the horses that we treat for habronimiasis. Now, in other cases, we can get this in the penis, and the treatment is the same. We have to debride, and we have to do ivermectin. We can put them in the chamber, and we can use topical ivermectin, topical creams such as DMSO, topical cortisone as well, because the cortisone sometimes help to prevent the hypersensitivity reaction. Well, and this was a crash course on habronema. Now I open it for questions so we can discuss the case, and you can bring your cases that you have. I know you guys have a bunch in the clinic now.
Hi, doctor.
Hi, Brian.
It's gonna be contagious.
No, this is not contagious. Thank you for asking that. Yes, let's say you have a horse. Let's say you have one horse in your barn that has it, and another 15 horses. It's not necessarily going to be contagious from horse to horse, but you can almost guarantee that if you have a horse with it, that means that all the horses will have the larva present, right? And this is one of the things that we were talking about, that there is a possibility predisposition by some horses with a low immune system by some horses. So in the same barn, you have 15 other horses and only one with habronema. Well, that horse was predisposed. The other horses, most likely, they have, if they share paddock, if they share barn, if they share manure bin, etc., they probably have the same exposure, but they did not develop it. But one horse to another cannot pass it. That's what they call because they need this. They need the fly. So it's very important. For this to happen, they need the fly. 100% you need the fly. So from horse to horse, you cannot pass it if there's no fly in it. Now, if there is a fly problem and you have two horses or more with the sensitivity to it, that's when it can pass. It can go from one horse to the other because of the fly. Good. Thank you for asking, Brian. I hope that answered your question.
Yeah, yes, sir. Thank you.
Okay, good. Good. What is the worst thing that could happen? The worst thing that could happen is that it's not habronema, and that is something called pitiosis. In United States, we call it swamp canker here in Florida. And what is pitium? It's not a bacteria. It's not a parasite. It's not a nematode. It is a thing on its own. It's an organism on its own. And it creates a similar hypersensitivity reaction. And it has something called cankers, which to the naked eye might look just like that picture that you see in front of you, but it actually, the cankers are a lot bigger and it's a lot more aggressive. The pitium becomes bigger and bigger a lot faster than the habronema. You can almost see it eating out the body in front of you. That's how aggressive the pitiosis is. The treatment for pitium is relatively similar. We have to debride it. but there's also a vaccine for it. We have to make sure that we get the vaccine ASAP. To slow down the PTOsis, we put them in the hyperbaric chamber to slow it down. It's not going to cure it, but usually we slow it down and help the immune system improve until we get the vaccine, until we get the debridement and all that. But the PTM could be lethal, could definitely kill a horse, while Habronema hardly could kill a horse. I mean, think about it. If it didn't kill this horse, which is probably the worst one I have seen, it might have a hard time killing horses. Marta, I have a case of an old mare that had the first case in the face. Later during the same season, it started in 2 of the legs and the abdomen. She started losing weight even though she was eating well. There's a possibility that it's something systemically. Yes, thank you for asking that. Oh, that was such a good question. Good. In this paper over here that I share with you guys in the chat, it actually says that it could go into the viscera. It could definitely cause it to go internally. Yes, thank you for asking. Especially if that larva for some reason is not ingested. If the larva doesn't go in the stomach of the horse and it goes somewhere else, whether it's in the skin or the abdomen or the lymphatic, somewhere else, if that larva doesn't go, it will potentially cause a granulomatous problem, and then it could cause the hypersensitivity reaction anywhere in the body. Excellent question. Good deal. Lameness, could it cause lameness? I have seldom seen it cause him lameness. Most horses that I have seen him are perfectly sound, and if they have lameness, it's due to something else. However, bear in mind, PTOsis, I have seen it getting so deep into the tendons and ligaments that could cause lameness. So PTOsis could in the advanced case, but these ones might not. Now, another thing that we have noticed when we put them in the hyperbaric oxygen chamber is that when we pressurize that, those larvae start coming out. It helps pushing them out of the body, and it helps healing. Good deal.
Doc, is there a way to know if you've like gotten all of the larvae out of the summer sore?
There's a way to know. There are some horses that I keep digging and digging and I get more, and then I go next day and I get more, and I go next day and I get more. There's some horses. The way to know, theoretically, yes. Theoretically, the way to know is to keep digging until you find no more. But take this case, for example, in front of you. Look to the extent of it, right? Think about, put yourself in kind of think about inside this horse. How deep can we really go to try to get all those eggs? There are millions and millions and millions of those larvae in there. How deep can we go? So it is safe to assume that that we don't get them all, and that's one of the reasons I like the topical medications, because it seems like the body itself is going to keep pushing them out, and then they get extracted. It helps extracting them, and we depend on the body to heal. This disease depends so much in the body. If the body
what other ways could you help get those eggs out aside from debridement or hyperbaric?
Well, that you have to debride. You have to debride, and then the ointments. That's why the ointments help a lot, because one of the things that the ointments do is they have dexamethasone, right? which the dexamethasone will also help decrease the itchiness, the uncomfortability that the horses develop. So that on its own, by decreasing the inflammation, will start helping release some eggs. So you put the ointment today. In this particular horse that I'm showing you, you put the ointment today, and 2 days later, you can with your hands literally scoop some eggs out. And then we repeat the process, and we repeat the process until we get it all out. There's an interesting question in the chat regarding ozone. This is a very, very good question. Could you put ozone in it? Absolutely. Willie, you remember if we did ozone on this horse? I don't remember, because I think that we went to just.
No, we went to hyperbaric, but we have done ozone. We have done ozone before in another horse with and we hold it with a fluid bag, so 5-liter fluid bag, and we kind of capsule the ozone around the area.
Yeah, so you could do ozone bagging, and that is pretty effective. To do ozone bagging, you can actually look it up on our. You can look it up on our ebook, and I'm gonna put it right here in the chat. You can look it up on the ebook, and there's a picture of ozone bagging. Let's see if I can, for the benefit of all, maybe I can open it up over here and find it.
And we've been sub-Qing ozone into the summer sores on Magarabi.
Can you report on that?
Yeah.
Do you think it has been helping?
Correct. Yeah, I believe it has. I absolutely believe it has.
Good. All right, Marta, so that's your answer right there. Ozone is a yes.
Yeah, sub-Qing the side of it.
Good. Now, the tricky one would be for the inside, for the abdominal one, because I have never been able to prove if I have a horse with abdominal one. I guess that unfortunately the only way to prove it would be a necropsy or exploratory surgery, but that's another thing over there. Excellent. Good questions and discussions.
And the summer sore also as well, it can come back next year.
Yes, that's what we were saying, that they have some horses just come back year after year. And sometimes here in Florida, we just tell the client, hey, take him up north. Find somewhere else, because it's so difficult sometimes in Florida to control the flies. So in summary, take care of the flies, keep it dry, ivermectin, debride as much as you can, ozone, IV and bagging. If you're lucky enough to find a hyperbaric chamber, use it. And another thing that we have not.
Don't refer to us.
Or send it to Epic.
Doug, I have another question.
Oh, who's this?
Maria Camila.
Yes.
About the like the healing of the summer sore, to what like extent it is good to maintain like a bandage, taking like account the stages of healing. Like you say that have to be dry, but sometimes if we still with bandage, depend of the side of the summer sore, the bandage sometimes doesn't help with the dry thing that we need. So how many days, or in what cases, or like explain a little bit more about the bandage, because I was reading that we need bandage, but no every time. So please explain it.
Yeah, great question. What happens? Think about this. What happens if you have an open wound? Just think about it. What happens in an open wound? What products of the body are released when you have an open wound. Okay, so I want you to think about that, and then I want you to, I'm going to show you something. Now that you thought about it, you have the answer. I'm going to show you the paper that I just shared with you, okay? Now, right here in this paper, I'm going to show you about this fly. I'm going to read it for you over here. The house and face fly are non-biting nuisance flies that feed on hosts' eye secretions, nasal discharges, and blood, and purulent discharges from wounds and dung, nasty fluids, but also blood, right? So when are you gonna have a higher chance of a fly feeding from a wound? When it's closed or when it's open? When it's closed. And that's why I promote to close the wounds and keep in bandages, because you have it open and all of a sudden a fly decides to travel 3 kilometers from the neighbor and lands on that wound, and unfortunately starts the cycle again. So that's why I keep them. That's why I like to keep them as close as possible. If you have an air conditioning room like we do at Epic, and somehow you manage to keep those flies away, you could attempt to keep, and the wound is dry, you could attempt to keep it open. However, it'll be tricky, it'll be tricky. Does that?
Doc, and what about with the places that we cannot bandage, like how we can treat it very well?
What a pain in the butt they are, huh? They're just a pain in the butt. What I do with this is I keep them as moist as not moist, but keep the ointment on it. The more you put the ointment, the better, because flies don't like DMSO and they don't like furazine. They stay away from that. So the more you can put DMSO in those areas. A good question for you, because we could have a horse with a hip wound, right? And then sometimes we have these plastic bandages that we can put on the hip wounds to close it up, but sometimes it's very difficult to keep it closed and they might have to stay open. So on those, for example, you could put it 2 or 3 times a day, 4 times a day if it needs to.
Okay, Doc, thank you. And the last question that I have is
Yes.
because also I was reading about, of course, the good and bad things about the bandages. And sometimes the bandages let the skin start to sweat and they can't allow for a proper healing. So how many times we have to change the bandage, or yeah, this is my question because I was confused about bandage are good or no are not good for some places.
Bandages are some of the most dangerous tools that we have. A bandage can ruin a horse for a very long time. A bandage can damage a tendon. A bandage can cause a wound, a skin abrasion. Bandage can do a lot of damage. So the bandage needs to be well kept, dry, well maintained, change either daily or every 2 days, depending where you are. When I was in Pennsylvania and it was cold, I didn't have to change the bandage. Maybe three times, maybe every 3 days or so, maybe every 4 days. It stays dry, cool. The horse don't sweat. Now, if the horse starts sweating, if it gets wet and bandage get nasty, you might have to change it every day. You might have to change it twice a day, depending where you are. So you have to use your clinical sense, and definitely putting bandages is almost an art. You could get a lot of damage with bandages, and that's why some people move away from bandages. But a well-placed bandage, the more you practice, the better you get at it, the better you're gonna do for the horse. So I am pro bandages in really hot, wet environments. We'll change it daily. In dry, cool environments, every 2-3 days, and I have gone in the north up to every 4 days or more.
I got some stuff I can add on to that, especially for the bandaging part. Because with Maserati, I was keeping him bandaged every day, constantly, and then he'd go in the cold salt water spa, and then he'd come out and have him bandaged up. So I would hit a lot more plateaus for a lot longer, and I kind of forgotten some of the basic concept of healing is that it was too moist. It was not a bad moist because it was constantly either cold salt water spa or constantly bandaged, but it can certainly slow it down. So I've been finding with at least Maserati summer sores that doing like a 2 on 1 off or 3 on 1 off kind of a situation in terms of having it bandaged and leaving it open while he's in the AC room, of course, without flies being able to get to it, has been able to really help push that healing forward.
Yeah, you nail it. You have a horse that it lives in the air conditioning room and with a minimum flies. Now imagine this horse in the summer in an Amish barn in Pennsylvania with cows all around and horses in one side and a feeding trough in the center of the barn. You might not want to choose that approach on that particular horse.
No, certainly, but there's other options too that you could also maybe help. And I would think that they got those screen things to put on the legs. You could certainly do like maybe a tube cotton cling and then just kind of have some tape on the top and bottom to keep it secure. That'll could help keep flies off of it, but also could get
Yeah, that's a good one. Yeah, you're right. You're right, and we have used the what is it that the women's pantyhose that look like that have like vent? You have air can go in, so you see on top, silly at the bottom, and at the same time you have a lot of air going in. Yes, we have used that in the past as well. Excellent discussion. Very good. Anything else, or we're done? What is he talking about? Good. We have 15 more minutes. We can use it for questions. We could go home early. All right. Well, if we don't have any more questions, yeah, go ahead.
I think that they're trying to talk, but they're mute.
Oh, they're trying to talk.
No.
We're good. We're just discussing amongst ourselves.
Oh, awesome. Love that. That's the idea, to cause discussion. All right, good. So thank you very much, guys. You guys have a great day. For those of you who are here and are veterinarians working on your American certification, please don't forget, sign up for the TOEFL, take the TOEFL, which is the first step, and good luck on taking the TOEFL. Share with me your grades ASAP so we know where you are at. Camila, when do you take it?
I'm coming.
August 17. Yeah.
17. Excellent. Very good. Well done. And we know that Valentina will be taking it soon. And good luck, guys. Good luck.
Thank
All right.
you.
All right. Thank you.
Thank you,
Guys,
doctor.
have a good day. Bye-bye. If you want a topic for next week, show me a text on the chat. If not, I'm gonna do a surprise topic. Bye-bye.